Hi, I'm Doug Wilhite here from the Guerreri Heart and Vascular Center. Don't go changing the channel and breaking my heart. It's showtime.
This segment of Delmarva Life is brought to you by TidalHealth.
So we all know that exercise does the body good, even for that about 8.5 million Americans who are living with peripheral artery disease, or PAD.
So let's break that down and learn about a TidalHealth rehabilitation program that helps those living with PAD live a more active and healthy life. To help us with that is Dr. Douglas Wilhite, vascular surgeon with TidalHealth Peninsula Regional. Doctor, thank you so much for joining us this afternoon.
Absolutely.
All right, so let's just start off with the basic question. What is peripheral artery disease?
Peripheral arterial disease, or PAD, really is just a way of referring to blockages in the arteries that supply the blood flow to the extremities, the arms or the legs. Most commonly, people suffer with PAD in the legs.
Okay, so I'm going to jump to a conclusion here and guess that you're going to tell us to go to our doctor and check it out. Is there anything that might give us an idea, any kind of a symptom that, maybe I have an issue here to check out?
Yeah, and it's actually kind of tricky because a lot of PAD is asymptomatic or really doesn't cause significant symptoms. But for that group of patients where the blockages are becoming more severe, the first symptom that patients will get is something called claudication, which means that their muscles in their legs cramp up when they try to walk farther than the blood supply will let them. So a patient will usually say, gee, I can walk about a block or so, and then my calves hurt so much that I have to stop and wait for a minute while that blood flow catches back up, and then they can walk another block before they have to stop again.
Oh, wow. Are there people who are more at risk for PAD than others?
There's a few different things to think about. The biggest one is tobacco. That's really the major cause of most PAD these days. And the second largest factor is diabetes. Outside of that, there's some smaller risk factors such as hypertension and high cholesterol. But the most common thing we see across this is that it really increases with age group. For those of us in our 60s, about 5% or 1 in 20 of us will have PAD. By the time we make it to 75, that's up to 20%.
But rehabilitation is possible.
It is, absolutely. The first thing we start with for patients with PAD is what we call medical intervention, which is simply trying to correct, if they're smoking, trying to get them to stop smoking, help get the diabetes under control, use simple medications like aspirin. But the key to it is walking. That walking activity builds up backup blood flow that our body already has ready to go so that they can become asymptomatic.
That's wonderful. And TidalHealth actually next month is offering a PAD rehabilitation program. Tell us about it.
What it is simply supervised walking activity for patients that have PAD that's limiting their lives. So a physician can refer a patient to this PAD clinic, and over the course of 12 weeks, they'll have 36 sessions where they come in, receive some education, supervision by a trained professional, and kind of guided walking therapy so that they can build up that collateral flow. There's a lot of data to show that patients that participate in a program like this can double their walking distance in just 6 weeks and come out of a program like this with minimal symptoms and not needing any kind of surgical intervention.
Sold. Where do I sign up? No. You said talking to our doctor. Is that where we need to start to try to get in?
Yeah, that's absolutely the first thing to do, is to talk to your physician about symptoms that you think may be PAD. There's some simple testing that can be done to help assess whether or not this is the problem. Ultrasound is the most common modality that we use, so it's non-invasive. There's no sharp objects involved. And for patients that are found to have PAD, their primary care provider, their cardiologist, or their vascular surgeon can refer them over to the rehabilitation clinic to start a program like this.
Sounds like a great program, and we're looking forward to that getting started next month. We'll have all the information on our website, delmarvalife.com. Dr. Douglas Wilhite, thank you so much for joining us and telling us about this program today.
No sharp objects involved. That's always a good sign.
It is a good thing.